To me, cultural competency means having the knowledge, skills, and attitudes necessary to provide effective care to patients from diverse cultures and backgrounds. It involves understanding and respecting cultural differences and being aware of the impact these differences can have on health and healthcare experiences. Cultural humility, on the other hand, is a lifelong process of self-reflection and self-critique. It means recognizing the limitations of one's own cultural perspective, being open to learning from others, and addressing power imbalances in the patient-provider relationship. When caring for individuals from diverse backgrounds, I integrate evidence-based cultural considerations into my practice. This means staying informed about the latest research on cultural influences on health behaviors, communication styles, and health disparities. For example, when working with a patient from a different cultural background, I start by engaging in active listening to understand their perspectives, beliefs, and values. I use validated cultural assessment tools to gather relevant information and incorporate their cultural context into their care plan. Let's consider a scenario when I'm caring for a patient from a Hispanic background who has diabetes. Research shows that cultural factors such as dietary habits and health beliefs significantly influence diabetes management in Hispanic populations. To provide culturally competent care, I would encourage cultural sensitivity in communication. I would use the patient's preferred language and, if needed, provide a medical interpreter. I would show respect for their cultural norms and values during all interactions. I would understand and respect traditional remedies that the patient may use and find ways to integrate them into medical treatments, but safely. I would collaborate with the patient to create a diabetes-friendly meal plan that respects their cultural dietary preferences, and I would ensure that it is both acceptable and effective to them. According to the CDC, Hispanic adults are 1.7 times more likely to be diagnosed with diabetes compared to non-Hispanic whites. This disparity is influenced by factors such as socioeconomic status, access to healthcare, and cultural barriers. To address the disparities, I would implement community health programs that provide education and resources in culturally appropriate ways. For example, diabetes education classes in Spanish led by bilingual health educators. I would advocate for policies that improve access to healthcare for underserved populations, such as expanding Medicaid or providing support for community health centers. I would ensure that healthcare providers receive training in cultural competency and humility to better understand and address the needs of diverse populations. In summary, cultural competency and humility are essential for providing respectful, personalized care to patients from diverse backgrounds. By integrating evidence-based cultural considerations and addressing disparities through targeted interventions, we can improve health outcomes and promote equity in healthcare. Thank you for watching.